Gentlemen, have you ever found yourself genuinely curious about why some women choose to engage in anal sex? Is it a pursuit of their own pleasure, a gesture to please their partner, or is the reality something more nuanced and complex that we rarely discuss openly? I'm Dr. Evelyn Reed, a urologist and pelvic health specialist, and today we're going to explore the surprising and deeply personal reasons behind this intimate choice. Insights that most men never have the opportunity to hear about, but that possess the profound power to completely reshape the way you understand and connect with your partner. Before we dive into these delicate details, I'd like to ask you a small favor. If you're finding this topic relevant, please like this video, comment below with where you're watching from, and subscribe to the channel. Trust me, taking the time to truly understand this aspect of intimacy will not only make your relationships healthier, but will also pave the way for more enjoyable and mutually satisfying experiences for everyone involved. Here is the first and perhaps most crucial thing to know. The pervasive idea that women engage in anal sex purely as a result of social peer pressure or the influence of pornography is, for the most part, a misleading myth. The reality, as illuminated by contemporary research, is that the motivations are far more complex, deeply personal, and often intertwined with a woman's individual narrative. For some, it is indeed a matter of personal desire and the pursuit of unique pleasure. For others, it's deeply rooted in relationship dynamics, a sense of curiosity, or even situational factors, such as the desire to avoid vaginal intercourse for a time. And yes, we must also acknowledge, with a heavy heart, that there are unfortunately situations involving coercion or a distinct lack of explicit consent. Understanding this full spectrum of reasons isn't just an academic exercise. It's the very foundation of respecting boundaries, enhancing shared pleasure, and improving communication, the undeniable cornerstones of all healthy and fulfilling intimacy. I'm Dr. Nora Hayes, and for the past 7 years, I've dedicated my practice to working with couples and individuals, helping them navigate the often tricky waters of sexual health and intimacy safely and with renewed confidence. I've sat across from countless patients and have seen firsthand how a deeper, more empathetic understanding of a partner's motivations and unspoken needs can completely transform an experience from one that is awkward, uncomfortable, or even painful, to one that is profoundly pleasurable, connecting, and fulfilling for both people. Let's break down the 6 main reasons, drawn from comprehensive studies on women's lived experiences, and explore what each one means from biological, emotional, and practical perspectives. First, being under the influence. Some women report participating in anal sex while under the influence of alcohol or drugs. Biologically, these substances can significantly lower inhibitions and cloud judgment, which can alter the perception of the experience. Emotionally, this blurred state can confuse genuine desire with a temporary lack of restraint, sometimes leading to experiences that are later felt as unwanted, uncomfortable, or even violating. Practically, if you are the partner, it is absolutely critical to never assume consent simply because someone is intoxicated. Always prioritize clear, sober communication and check in continuously to ensure you are both on the same page. Next, we have personal desire, a reason that actually increases pleasure and enjoyment for many women. Many women engage in anal sex simply because they find it personally and physically enjoyable. Biologically, the stimulation of the dense network of nerve endings in and around the anal region can create uniquely intense and pleasurable sensations, much like other forms of sexual activity when approached correctly. Emotionally, actively choosing and enjoying this activity can provide a woman with a powerful sense of agency, bodily empowerment, and deep intimacy with her partner. Practically, if your partner expresses curiosity or a clear desire to explore this, slow, attentive communication and the generous use of appropriate lubrication are non-negotiable for a positive experience. The third reason is pleasing a partner. Some women participate primarily to satisfy their partner's desires or fantasies. Biologically, this can still be an enjoyable act if both parties are fully attentive and present. But it may feel physically uncomfortable or rushed if the woman's own pleasure isn't considered. Emotionally, it can offer a profound sense of care, generosity, and connection when given freely. However, if the participation feels expected or forced, it can easily lead to simmering resentment, emotional pain, and a sense of detachment. The practical takeaway is to always ask and observe. Are they participating willingly and with enthusiasm? Remember, enthusiastic consent is what transforms a duty into a shared gift. Fourth, we have avoiding vaginal sex. Sometimes anal sex is consciously chosen as a specific alternative to vaginal intercourse, for instance, during menstruation, to reduce the risk of pregnancy, or during periods of vaginal discomfort or healing. Biologically, this provides a different sexual outlet while intentionally avoiding certain physical consequences or sensitivities. Emotionally, it can offer reassurance and comfort to both partners, ensuring that intimacy can continue even when vaginal sex isn't possible or desirable at the moment. The practical key here is open communication about preferences, timing, and hygiene to ensure the alternative is a positive and welcomed one for her. Fifth, quid pro quo exchange situations. In some more complex cases, women may engage in anal sex in exchange for something else, such as money, drugs, or other significant favors. Biologically, this can lead to physical strain or injury if the woman is not mentally or physically prepared or engaged. Emotionally, such transactional contexts can often create feelings of profound discomfort, shame, or a necessary emotional detachment as a coping mechanism. Practically, understanding this context is vital, as it highlights the extreme importance of ensuring that consent is not coerced by circumstance and that safety and respect are never compromised. Finally, the sixth reason is a deeply concerning one: a lack of explicit consent or outright coercion. Unfortunately, some women experience anal sex that they did not explicitly want or consent to. Biologically, this often results in acute pain, bruising, or more serious physical injury, as the body is not relaxed or prepared for the act. Emotionally, the impact can be severe, causing lasting trauma, fear, and significant emotional distress that can affect all future intimacy. The practical imperative here could not be clearer: always, without exception, prioritize clear, sober, and enthusiastic consent. And stop immediately if your partner shows any sign of being uncomfortable or hesitant. So, what does all of this mean for you as a caring and invested partner? Here are some practical, doctor-approved steps you can integrate. First, communicate openly and without judgment. Create a safe space to ask what your partner genuinely enjoys and what their comfort levels are. Second, use lubrication generously and without hesitation. Anal tissue is delicate and does not self-lubricate, so friction without ample lubrication can quickly cause pain or injury. Third, go impossibly slow. A gradual, patient progression protects delicate tissue and, just as importantly, builds the trust necessary for true relaxation and pleasure. Fourth, Check in constantly. Remember that consent is an ongoing conversation, not a one-time permission slip. Simple questions like, "Does this feel okay?" can make all the difference. Fifth, always respect a no. If your partner says stop or indicates discomfort, you stop immediately. Consent is mandatory, always, without exception. And finally, consider protection. Using condoms is a simple step that significantly reduces STI risk and helps maintain hygiene for both partners. Gentlemen, understanding these reasons isn't about passing judgment on any individual choice. It's about cultivating empathy and demonstrating genuine care. When you take the time to respect your partner's motivations, whether they stem from curiosity, a search for pleasure, or a sense of necessity, you transform intimacy into something safer, more enjoyable, and emotionally fulfilling for both of you. Remember, age never diminishes your ability to connect in meaningful ways. In fact, it can enhance it. It is the small, consistent changes, prioritizing communication, insisting on consent, preparing thoughtfully, and practicing patience that bring confidence, comfort, and a sense of freedom back into your sexual life. I'm Dr. Evelyn Reed, reminding you that vitality, confidence, and meaningful connection don't fade with age. They evolve and deepen with awareness and conscientious care. Treat yourself and your partner with the utmost respect and watch as your intimacy flourishes for years to come.